Hi dear friends, welcome to Medical Destiny YouTube channel. Before watching this video, please take a moment to subscribe my channel. In this video, you will go through 25 Nclex-Rn nursing examination multiple choice questions and answers. Read the question by yourself and find the correct answer. Let's begin.
156. A nurse is assessing a client who is being treated with a beta-adrenergic blocker. Which assessment findings would indicate that the client may be experiencing dose-related side effects of the medication? Select all that apply. 1. Dizziness. 2. Insomnia. 3. Bradycardia. 4. Reflex tachycardia. 5. Sexual dysfunction. 6. Cardiac dysrhythmias. Answer: 1, 2, 3, 5. Rationale. Beta-adrenergic blockers, commonly called beta blockers, are useful in treating cardiac dysrhythmias, mild hypertension, mild tachycardia, and angina pectoris. Side effects commonly associated with beta blockers are usually dose-related and include dizziness, hypertensive effect, insomnia, bradycardia, hypotension, and sexual dysfunction impotence. Options 4 and 6 are reasons for prescribing a beta blocker. However, these are general side effects of alpha-adrenergic blockers. 157. A client at risk for respiratory failure is receiving oxygen via nasal cannula at 6 L per minute. Arterial blood gas (ABG) results indicate pH 7.29, PCO2 49 mm Hg, PO2 58 mm Hg, HCO3 18 MEqL. The nurse anticipates that the physician will prescribe which of the following for respiratory support? 1. Intubation and mechanical ventilation. 2. Adding a partial rebreather mask to the current prescription. 3. Keeping the oxygen at 6 L per minute via nasal cannula. 4. Lowering the oxygen to 4 L per minute via nasal cannula. Answer: 1. Rationale. If respiratory failure occurs and supplemental oxygen cannot maintain acceptable PaO2 and PaCO2 levels, endotracheal intubation and mechanical ventilation are necessary. The client is exhibiting respiratory acidosis, metabolic acidosis, and hypoxemia. Lowering or keeping the oxygen at the same liter flow will not improve the client's condition. A partial rebreather mask will raise CO2 levels even further. 158. A nurse is preparing to assess the respirations of a newborn infant just admitted to the newborn nursery. The nurse performs the procedure and determines that the respiratory rate is normal if which of the following is noted? 1. A respiratory rate of 20 breaths per minute. 2. A respiratory rate of 40 breaths per minute. 3. A respiratory rate of 90 breaths per minute. 4. A respiratory rate of 100 breaths per minute. Answer 2. Rationale. Normal respiratory rate varies from 30 to 60 breaths per minute when the infant is not crying. Respirations should be counted for 1 full minute to ensure an accurate measurement because the newborn infant may be a periodic breather. Observing and palpating respirations while the infant is quiet promotes accurate assessment. Palpation aids observation in determining the respiratory rate. Option 1 indicates bradypnea and options 3 and 4 indicate tachypnea. 159. During a routine prenatal visit, a client in her second trimester of pregnancy reports having frequent calf pain when she walks. The nurse suspects superficial thrombophlebitis and checks for which sign associated with this condition. 1. Severe chills. 2. Chadwick's sign. 3. Brudzinski's sign. 4. Palpable thrombus that feels hard. Answer: 4. Rationale. Pain in the calf during walking could indicate venous thrombosis. The manifestations of superficial thrombophlebitis include a palpable thrombus that feels bumpy and hard, tenderness and pain in the affected lower extremity, and a warm and pinkish red color over the thrombus area. Severe chills can occur in a variety of inflammatory or infectious conditions and are also a manifestation of pelvic thrombophlebitis. Chadwick's sign is a cervical change and is a probable sign of pregnancy. Brudzinski's sign and Koenig's sign test for meningeal irritability. 60. A nurse evaluates the patency of a peripheral intravenous IV site and suspects an infiltration. Which does the nurse implement to determine If the IV has infiltrated, 1. Strips the tubing and assesses for a blood return. 2. Checks the regional tissue for redness and warmth. 3. Increases the infusion rate and observes for swelling. 4. Gently palpates regional tissue for edema and coolness. Answer 4. Rationale. When assessing an IV for clinical indicators of infiltration, it is important to assess the site for edema and coolness, signifying leakage of the IV fluid into the surrounding tissues. Stripping the tubing will not cause a blood return but will force IV fluid into the surrounding tissues, which can increase the risk of tissue damage. Redness and warmth are more likely to indicate infection or phlebitis. Increasing the IV flow rate can further damage the tissues if the IV has infiltrated. Additionally, a physician's prescription is needed to increase an IV flow rate. 162. A nurse is caring for a child with Ray's syndrome. The nurse monitors for signs of which major problem associated with this syndrome. 1. Protein in the urine. 2. Symptoms of hypoglycemia. 3. Increased intracranial pressure. 4. A history of a staphylococcus infection. Answer 3. Rationale. Ray's syndrome is an acute encephalopathy that follows a viral illness and is characterized pathologically by cerebral edema and fatty changes in the liver. Intracranial pressure and encephalopathy are major problems associated with Ray's syndrome. Protein is not present in the urine. Ray's syndrome is related to a history of viral infections, and hypoglycemia is a symptom of this disease. 164. A nurse admits a client to the hospital with a suspected diagnosis of bulimia nervosa. When performing the admission assessment, the nurse elicits data knowing that the client with bulimia 1. Binge eats, then purges. 2. Is accepting of body size. 3. Overeats for the enjoyment of eating food. 4. Overeats in response to losing control of diet. Answer 1. Rationale. Individuals with bulimia nervosa develop cycles of binge eating, followed by purging. They seldom attempt to diet and have no sense of loss of control. Options 2, 3, and 4 are true of the obese person who may binge eat, not purge. 165. The nurse is caring for a client who develops compartment syndrome from a severely fractured arm. The client asks the nurse how this can happen. The nurse's response is based on the understanding that 1. A bone fragment has injured the nerve supply in the area. 2. An injured artery causes impaired arterial perfusion through the compartment. 3. Bleeding and swelling cause increased pressure in an area that cannot expand. 4. The fascia expands with injury, causing pressure on underlying nerves and muscles. Answer 3. Rationale. Compartment syndrome is caused by bleeding and swelling within a compartment, which is lined by fascia that does not expand. The bleeding and swelling place pressure on the nerves, muscles, and blood vessels in the compartment, triggering the symptoms. Therefore, options 1, 2, and 4 are incorrect statements. 166. A client with an extremity burn injury has undergone fasciotomy to treat compartment syndrome of the leg. The nurse prepares to provide which type of wound care to the fasciotomy site? 1. Dry sterile dressings. 2. Hydrocolloid dressings. 3. Wet sterile saline dressings. 4. 1/2 strength beta-adrenergic dressings. 166. A client with an extremity burn injury has undergone fasciotomy to treat compartment syndrome of the leg. The nurse prepares to provide which type of wound care to the fasciotomy site? 1. Dry sterile dressings. 2. Hydrocolloid dressings. 3. Wet sterile saline dressings. 4. 1/2 strength beta-adrenergic dressing. 167. A nurse is caring for a female client who was recently admitted to the hospital with a diagnosis of anorexia nervosa. When the nurse enters the room, the client is engaged in rigorous push-ups. Which nursing action would be therapeutic? 1. Allow the client to complete the exercise program. 2. Interrupt the client and weigh the client immediately. 3. Interrupt the client and offer to take the client for a walk. 4. Tell the client that she is not allowed to exercise rigorously. Answer 3. Rationale. Clients with anorexia nervosa are frequently preoccupied with rigorous exercise and push themselves beyond normal limits to work off caloric intake. The nurse must provide for appropriate exercise as well as place limits on rigorous activities. Allowing the client to complete the exercise program could be harmful. Weighing the client reinforces the altered self-concept that the client experiences and the client's need to control weight. Telling the client that she is not allowed to exercise rigorously will increase her anxiety. 168. The nurse assesses a peripheral intravenous IV dressing and notes that it is damp and the tape is loose. The best nursing action is to 1. Stop the infusion immediately. 2. Apply a sterile, occlusive dressing. 3. Ensure tight IV tubing connections. 4. Remove the IV and insert a new IV. Answer 3. Rationale. To determine subsequent nursing interventions, the nurse checks all connections to ensure tight seals while the IV infuses to help locate the source of the leak. If the leak is at the insertion site, the nurse stops the infusion, removes the IV, and inserts a new IV catheter. The nurse applies a new sterile occlusive dressing after resolving the source of the leak. 169. The nurse assists the physician with the removal of a chest tube. During removal of the chest tube, the nurse instructs the client to perform which of the following: 1. Breathe in deeply. 2. Breathe normally. 3. Breathe out forcefully. 4. Exhale and bear down. Answer 4. Rationale. The client is instructed to perform the Valsalva maneuver. Take a deep breath, exhale, and bear down for chest tube removal. This maneuver will increase intrathoracic pressure, thereby lessening the potential for air to enter. Are the pleural space. Therefore, options 1, 2, and 3 are incorrect. 170. The nurse assesses the water seal chamber of a closed chest drainage system and notes fluctuations in the chamber. The nurse determines that this finding indicates that 1. The tubing is kinked. 2. An air leak is present. 3. The lung has re-expanded. 4. The system is functioning as expected. Answer 4. Rationale. Fluctuations, tidling, in the water seal chamber are normal during inhalation and exhalation until the lung re-expands and the client no longer requires chest drainage. If fluctuations are absent, it could indicate occlusion of the tubing or that the lung has re-expanded. Excessive bubbling in the water seal chamber indicates that an air leak is present. 171. The nurse is developing a care plan for an older client being admitted to a long-term care facility. Appropriate information to remember when planning nursing interventions for this client are which of the following? Select all that apply. 1. Most older clients are incontinent. 2. Older clients are at risk for dehydration. 3. Depression is a normal part of the aging process. 4. Age-related skin changes require special monitoring. 5. Older clients are at risk for complications of immobility. 6. Confusion and cognitive changes are common findings in the older population. Answer 2, 4, 5. Rationale. One of the normal physiological changes that occur during the aging process is loss of skin integrity. Older clients are at risk for dehydration and complications related to immobility. Incontinence, depression, confusion, and cognitive changes are not normal parts of the aging process. 172. The nurse understands that which of the following are clinical indicators for intravenous IV fluids. Select all that apply. 1. Syncope episodes. 2. Bounding pulse rate. 3. Chronic renal failure. 4. Rapid, weak, and thready pulse. 5. Serum electrolyte abnormalities. 6. Abnormal serum and urine osmolality levels. Answer 4, 5, 6. Rationale. Common abnormal assessment findings of major body systems offer clues to fluid and electrolyte imbalances. Intravenous fluid and electrolyte therapies are commonly used to correct many fluid and electrolyte imbalances in the body. Rapid, weak, and thready pulse is a common assessment abnormality found with fluid and electrolyte imbalances. Abnormal serum and urine osmolality are laboratory tests that are helpful in identifying the presence of or risk of fluid, electrolyte, and acid-base imbalances. Isolated episodes of syncope are not indicators for intravenous therapy unless fluid and electrolyte imbalances are identified. A bounding pulse rate is a manifestation of fluid volume excess, therefore IV fluids are not indicated. Clients with chronic renal failure experience the inability of the kidneys to regulate the body's water balance. Fluid restrictions may be used. 173. A child is admitted to the hospital with a diagnosis of rheumatic fever. The nurse reviews the blood laboratory findings, knowing that which of the following will confirm the likelihood of this disorder. 1. Increased leukocyte count. 2. Decreased hemoglobin count. 3. Increased antistreptolysin or ASO. 4. Decreased erythrocyte sedimentation rate. Answer 3. Rationale. Children suspected of having rheumatic fever are tested for streptococcal antibodies. The most reliable and best standardized test to confirm the diagnosis is the ASO titer. An elevated level indicates the presence of rheumatic fever. The remaining options are unrelated to diagnosing rheumatic fever. Additionally, an increased leukocyte count indicates the presence of infection but is not specific in confirming a particular diagnosis. 174. A 5-year-old child is admitted to the hospital for heart surgery to repair the tetralogy of Fallot. The nurse reviews the child's record and notes that the child has clubbed fingers. The nurse understands that the clubbing is most likely caused by 1. Tissue hypoxia, 2. Chronic hypertension, 3. Delayed physical growth, 4. Destruction of bone marrow. Answer 1. Rationale. Clubbing, a thickening and flattening of the tips of the fingers and toes, is thought to occur because of a chronic tissue hypoxia and polycythemia. Options 2, 3, and 4 do not cause clubbing. 175. The nurse plans care for a client diagnosed with end-stage renal disease (ESRD). Which findings does the nurse expect to find in the client's medical record? Select all that apply. 1. Edema. 2. Anemia. 3. Polyuria. 4. Bradycardia. 5. Hypotension. 6. Osteoporosis. Answer 1, 2. Rationale. The manifestations of ESRD are the result of impaired kidney function. Two functions of the kidney are maintenance of water balance in the body and the secretion of erythropoietin, which stimulates red blood cell formation in bone marrow. Impairment of these functions results in edema and anemia. Kidney failure results in decreased urine production and increased blood pressure. Tachycardia is a result of increased fluid load on the heart. Osteoporosis is not a common finding with ESRD. 176. A nurse is performing range of motion (ROM) exercises on a client when the client unexpectedly develops spastic muscle contractions. The nurse should implement which interventions? Select all that apply. 1. Stop movement of the affected part. 2. Massage the affected part vigorously. 3. Notify the physician immediately. 4. Force movement of the joint supporting the muscle. 5. Ask the client to stand and walk rapidly around the room. R6. Place continuous gentle pressure on the muscle group until it relaxes. Answer 1. 6. Rationale. ROM exercises should put each joint through as full a range of motion as possible without causing discomfort. An unexpected outcome is the development of spastic muscle contraction during ROM exercises. If this occurs, the nurse should stop movement of the affected part and place continuous gentle pressure on the muscle group until it relaxes. Once the contraction subsides, the exercises are resumed using slower, steady movement. Massaging the affected part vigorously may worsen the contraction. There is no need to notify the physician unless intervention is ineffective. The nurse should never force movement of a joint. Asking the client to stand and walk rapidly around the room is an inappropriate measure. Additionally, if the client is able to walk, ROM exercises are probably unnecessary. 177. A client has been admitted to the hospital with a diagnosis of acute glomerulonephritis. During history taking, the nurse should first ask the client about a recent history of 1. Bleeding ulcer, 2. Deep vein thrombosis, 3. Myocardial infarction, 4. Streptococcal infection. Answer 4. Rationale. The predominant cause of acute glomerulonephritis is infection with beta-hemolytic streptococcus 3 weeks before the onset of symptoms. In addition to bacteria, other infectious agents that could trigger the disorder include viruses, fungi, and parasites. Bleeding ulcer, deep vein thrombosis, and myocardial infarction are not precipitating causes. 78. A client has just been admitted to the emergency department with chest pain. Serum enzyme levels are drawn, and the results indicate an elevated serum creatine kinase, CKMB isoenzyme, troponin T, and troponin I. The nurse concludes that these results are compatible with 1. Stable angina, 2. Unstable angina, 3. Prinzmetal's angina, 4. New onset myocardial infarction, ME. Answer 4. Rationale. Creatine kinase, CKMB isoenzyme is a sensitive indicator of myocardial damage. Levels begin to rise 3 to 6 hours after the onset of chest pain, peak at approximately 24 hours, and return to normal in about 3 days. Troponin is a regulatory protein found in striated muscle, skeletal, and myocardial. Increased amounts of troponins are released into the bloodstream when an infarction causes damage to the myocardium. Therefore, the client's results are compatible with new onset ME. Options 1, 2, and 3 all refer to angina. These levels would not be elevated in angina. 179. As part of cardiac assessment, the nurse palpates the apical pulse. To perform this assessment, the nurse places the fingertips at which of the following locations: 1. At the left midclavicular line at the 5th intercostal space. 2. At the left midclavicular line at the 3rd intercostal space. 3. To the right of the midclavicular line at the 5th intercostal space. 4. To the right of the midclavicular line at the 3rd intercostal space. Answer 1. Rationale. The point of maximal impulse, PMI, where the apical pulse is palpated, is normally located in the 4th or 5th intercostal space at the left midclavicular line. Options 2, 3, and 4 are not descriptions of the location for palpation of the apical pulse. 180. A nurse is caring for a client receiving bolus feedings via a nasogastric tube, NGT. Which position does the nurse use to administer the feeding? 1. Supine, 2. Semifowlus, 3. Trendelenburg's, 4. Lateral recumbent. Answer 2. Rationale. Clients are at high risk for aspiration during an NGT feeding because the tube bypasses a protective mechanism, the gag reflex. The head of the bed is elevated 35 to 40 degrees to prevent this complication. By facilitating gastric emptying, the remaining options increase the risk of aspiration by blunting the effect of gravity on gastric emptying.